Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be answering a few of the questions we've received on our channel, and hopefully answer some of the questions you may have as well. So if you haven't yet, make sure to subscribe to the video, tap the like button, tap the notification bell, and we'll go ahead and get started here. So first question is from Toby. I have a question. So the orthodontist put spacers in my mouth a couple days ago, and it is so hard to chew. Is that normal? So those who aren't familiar, spacers are little tiny rubber bands that get placed between the back molars and the side teeth, and what those do is they gradually just open up a little bit of space so that a band could be placed over the teeth. This is the first time that your teeth have moved, and as such they're going to be really sore. It's kind of like the first time you go out and you run. If you haven't done it before, your legs are going to feel really sore, but as you start doing it more often and more regularly, legs don't get nearly as sore. So it's the same thing with your teeth. That first week is definitely the most rough period, and it is going to be really sore and it's going to be hard to chew. But after about a week, you adapt, you get used to it, and it's no big deal. So again, stick with it. It just happened a few days ago. It's probably the most sore time right now. Take some Tylenol or Advil, whatever you take for headaches, and you should get through it. You just have to have a little bit of patience and endurance. So next question. I'm a 19-year-old and I've had braces since I was 12. I'm on my second set of braces. I've been waiting on surgery ever since. It always gets canceled, or my orthodontist says I'm not ready for it. I'm sick and tired of hurting every day from braces. I'm an adult now and ready to figure something out. I watch all your videos, so it seems like I may be able to be helped. I have a mild, moderate underbite, and it kills me every day to live with. Please help. Lots of stuff going on with this question here. So looks like they're on their second set of braces. So what often happens in patients who are started, a little young, like 11 or 12, if they have the tendency to get an underbite, a lot of times that growth isn't expressed until later in life. So again, trying to read between the lines here, they probably had braces once, got their teeth corrected, had the braces off, but their jaw continued to grow. And unfortunately that happens sometimes. It's really unpredictable. We can't say who's going to grow, who's going to stop. And so if they continue to grow and grew out from that correction, then a second set of braces may be needed. So looking at, I'm 19 years old, I had braces since I was 12, I'm on my second set of braces. I assume that doesn't mean you've had 7 years of continuous braces. I assume you had a set of braces, a little break, and then braces again to correct the bite and get prepared for surgery. So my surgery always gets canceled, or my orthodontist says I'm not ready for it. So again, prior to surgery, everything needs to be set up and ready. All the teeth need to be aligned. All the teeth need to be engaged with the wire. We need to be in the full-size wire. And everything needs to be set prior to that surgery. So surgery only happens once, so it's important to make sure that we do it right. This is a big deal. It's a big thing to pay for and a big event to go through yourself. So absolutely, it's definitely worth putting in the time to make sure you're prepared for that surgery so that it can be successful. Because again, we only have one shot at this. So I understand you're tired of hurting from braces every day, and hopefully your orthodontist, I'm sure they have your best intentions in mind and they're doing what's right for you. I would definitely ask specifically your orthodontist to get a timeline as far as what's next. By age 19, you're definitely, your growth should be done. You should be ready for the surgery from your growth standpoint. As far as your teeth standpoint, that is to be determined by your doctor. But also they do have to coordinate with the oral surgeon, the hospital schedule, the anesthesiologist, make sure there's an operating room available. So lots of moving parts here. And so again, I would ask your doctor for more specific questions, but it is something that it has to be done correctly because we only got one shot at this. So it's worth putting in the time to make sure everything's ready before jumping in. So hopefully that helps. And again, good luck with your surgery. I know it's frustrating. I wish you the best of luck and hopefully you have a great outcome. All right, next question. Why do teeth still keep on moving even after having my teeth straightened twice already over a long period of time? They haven't shifted as much as before, but it's now only 5 years later and some are already slightly moving out again. And yes, I wear my retainers and do have fixed upper and lower front retainers. So if you have fixed retainers or glued-in retainers, I'm assuming that those teeth haven't moved dramatically. If other teeth have moved or shifted, you may be due for a new removable retainer. So removable retainers are made of plastic. They do tend to loosen over time, and they may allow some amount of tooth shifting or movement. So unfortunately, it's one of those things. Our teeth shift throughout our whole life. The only way to make sure that they stay exactly where we want them is by wearing retainers for life. And then that also means getting new retainers periodically as well. We recommend all of our patients get new retainers every year just to make sure their teeth stay straight. So we wish we could figure this out to where your teeth never moved. It's probably not going to happen. It's just part of our body, is everything's always changing. And the only way to maintain correction forever is by having a new retainer and wearing it long term. So hopefully that helps. Good luck with everything. All right, next question. I have an overbite and got braces to fix it. Got 2 premolars removed from the top and just 1 from the bottom. Will my smile look misaligned after the treatment is over because I only got 1 premolar extracted from the bottom? So this is something that happens periodically. So depending on how your teeth grew in, how the whole process unfolded, you may have some asymmetry, meaning that the teeth weren't fully aligned with your face. So a lot of times this will happen if you have a baby tooth lost early. The teeth will shift one direction or the other, and based on how those teeth grew in, if we need to move things around to get the midlines onto the face, we may only remove a premolar on one side or the other. So again, that happens. It's fairly common, and usually it's not something to be overly concerned about. So in your case, having 2 premolars removed on the top and 1 on the bottom, I would say it's probably going to end up great. I obviously can't see your teeth personally, but that is something that we will take into consideration. Not everybody's treated exactly the same. Sometimes we'll have 2, 3, or 4 teeth out, and all that is taken into account, like what does this patient present with, where do we want the teeth when we're done, and how are we going to get there. And so again, ask your doctor specifically. They'd probably love to explain this and hopefully get you a little bit more information about your case specifically. Next question. Does it hurt during and after braces installation? So most of the time, anytime you're in the office, nothing really hurts. When getting braces on, when getting them adjusted, nothing is really too painful. You don't have to get any shots. There's no numbing. There's nothing really invasive. It's mostly when you get your braces on, they dry the teeth off and glue braces on. So you do have to have some contraptions and gadgets to kind of keep your cheeks and lips away from your teeth. Those aren't the most comfortable things, but they're definitely not too painful. We do braces on kids as young as 7. They do fine. So again, I wouldn't worry too much about getting braces on. After your teeth start moving, you definitely will get some soreness. So I use the example again. If you go out and run 3 miles and you've never run before, your legs are going to be sore the next day. But as you continue running, that soreness goes away and your body adapts. It's the same thing with your teeth. That first week is tough with braces. Your teeth will hurt. They will be sore. You want to eat soft foods. After about a week, you're usually through the worst of it, and it's really not too bad. So again, a lot of people get braces. Everybody goes through that first week, but everybody gets through it, and almost everyone would say they would do it again in order to get the result from the smile. So it's worth it, and definitely stick with it if you have any soreness during that first week. So that's it for this video. If you found this video helpful, please give it a like. Make sure to subscribe to the video if you haven't yet. Tap the notification bell to be notified when we release new videos. And if you have any follow-up questions, feel free to ask them in the comments section below. We'll do our best to answer, and they may be featured on a future video. Thank you so much for watching, and we'll talk to you soon.